I'm Jamie Woods, and in 2019, I was diagnosed with acute promyelocytic leukemia. I had a year's worth of chemotherapy. I was in hospital for the best part of 2.5 months. But the thing that really affected me, apart from the illness itself, was the damage it did to my mental health. I've always struggled with my mental health, with depression, with anxiety. But the experience of having leukemia really amplified that. I developed PTSD as a result of a lot of the trauma that I went through while being seriously ill. And, I was getting panic attacks in hospital. And it's kind of hard to be happy, when you do have something quite so seriously wrong with you. So, the depression quickly came back. The thing for me is that I think healthcare professionals, their primary job in the hematology department, in the oncology department, is to treat the leukemia. What I'm really passionate about is making sure that people also get help for the mental health as well as the physical health, because it can make all the difference. At one point during my treatment, I'd had enough. I couldn't see the light. I had pneumonia. On top of the leukemia, I was really, really ill, and I was having more drugs put into me than there were hours in the day. There just wasn't enough time to fill me with that amount of medicine. They couldn't work out what could cure the particular type of pneumonia I had. And I was fading. I ran out of that ability to keep going. I was fortunate that I had strong support from my wife to keep me going, to make me take that medicine and to stop, just giving up. And it's really difficult because I understand that, it's important to treat the actual cancer. It's important to have the chemotherapy. But speaking to other patients, I see that I'm not alone in this, that our mental health as a leukemia patient is often just treated as a secondary event, like a side effect that you just have to get used to. And while I was okay, putting Lipsil on my lips because I had really dry lips, or I was okay with my hair coming out, I was expected to just be okay with my mental health. And that was really, really challenging. I also had problems with like survivor's guilt afterwards as well. I've been lucky enough to have a substantial amount of therapy in the last 2 years, because I wasn't coping day to day. I'd keep getting triggers and flashbacks to when I was in hospital, and thinking all those kind of, of those really sad times in my life, those sad times when I was ill. And that's why I'm really quite strongly campaigning to help raise awareness of mental health in leukemia patients, because it's not an easy illness to have. And we need to have that secondary support, that holistic support to look after the whole person and not just the illness.